Get out of my trauma bay, Brennan. Rachel did not look up from the chart. She kept her pen moving, steady, deliberate. I said, get out, Dr. Vincent Marsh repeated. His voice carried the particular edge of a man who had been told no too many times in his life and had never learned to process it. You are a floor nurse. This is a trauma bay. You do not belong here. Rachel finished the notation. She capped her pen. She looked at him. Marsh was 53 years old and still carried himself like a soldier, which was the only military thing left about him. The Army had taken his commission 11 years ago. Something about a patient who died on the table in Bagram and paperwork that did not match the timeline. Nobody at University Medical Center in Norfolk talked about it openly. But nurses talk. Nurses always talk. Dr. Caldwell asked me to pull the labs on bed 4, Rachel said. Her voice was even, not warm, not cold, just flat. I pulled them. Caldwell is off rotation. Marsh stepped closer. He was a big man. Broad shoulders, thick neck, the kind of build that intimidated orderlies and first-year residents. I am running this bay tonight, and I did not ask for you. Noted, Rachel said. She walked out. That was the thing about Rachel Brennan that nobody at University Medical Center could quite figure out. She never fought back. She never raised her voice. She never filed a complaint, never cried in the break room, never vented to the other nurses over cold cafeteria coffee. She just absorbed whatever Marsh threw at her and kept moving. Some of the younger nurses thought she was a pushover. Maria Chen, who had been working the cardiac floor for 6 years, had a different theory. That woman is not afraid of him, Maria told anyone who would listen. That woman is just not interested in him. There is a difference. Rachel had been at UMC Norfolk for 3 years. She had arrived in January, midwinter, with a single duffel bag and a rental agreement for a studio apartment 4 blocks from the hospital. No references beyond a 2-year stint at a small clinic in Colorado that checked out fine. No social media. No emergency contact on file. The HR coordinator had flagged it as unusual. The nursing director, a practical woman named Sandra Holt, had looked at Rachel's clinical skills during the working interview and decided that a nurse who could start a peripheral IV in a collapsed vein in under 40 seconds did not need an Instagram account. Nobody asked many questions after that. Now, before we go any further, there is something you should know about this hospital, because it matters to everything that happens next, and if you miss it, the rest of this story will not hit you the way it is supposed to hit you. University Medical Center was not just any hospital. It sat 12 miles from Naval Station Norfolk, the largest naval installation in the world. On any given night, the ER handled active duty sailors, civilian contractors, the families of deployed officers, and occasionally personnel whose paperwork described their jobs in very vague terms that nobody investigated too closely. The staff had learned over the years not to ask too many questions about the men in civilian clothes who sometimes came through with injuries that did not quite match their cover stories. Rachel had noticed that from day one. She had also noticed the cameras. 14 visible. 3 she was fairly sure were disguised as smoke detectors on the east corridor. She had noticed the 2 men in gray suits who sat in the family waiting area twice a week and never seemed to be waiting for anyone in particular. She had noticed the way the security desk on the 2nd floor was staffed differently whenever certain patients were admitted to the VIP wing. The break room at 11:15 on a Thursday night was empty, except for Rachel and a vending machine. She poured coffee that had been sitting since 7. She drank it anyway. Her feet hurt. That was new. 3 years ago, her feet never hurt. 3 years ago, she had been doing things that would make a 12-hour nursing shift feel like a spa day in Tuscany. But that was before. Before Virginia. Before the name change. Before the studio apartment with the deadbolt she had installed herself and the window she checked every night before bed. Not because she was afraid, but because old habits do not ask permission before they move in and redecorate. Before she decided that saving lives in a hospital was better than the alternative. She was reaching for a second cup when Maria Chen walked in, looking like she had just seen a car accident on a roller coaster. "You hear about the VIP admission?" Maria asked. "No. Coming in tonight. Secret Service already swept the 4th floor." Maria lowered her voice even though they were alone, because Maria always lowered her voice for good news as well as bad news. It was just her way. Someone said it is a retired 4-star, Navy. Rachel wrapped both hands around her coffee cup. Which 4-star? She said. It was not quite a question. Maria shrugged. Nobody is saying the name. Holt pulled 4 nurses from regular rotation and put them on the 4th floor tonight. Jones, Park, Williams, and Maria checked her phone and knew. Rachel was quiet for 3 seconds. Me, she said. Holt specifically requested you. Said something about your cardiac background. Maria tilted her head. I did not even know you had a cardiac background. I did a rotation, Rachel said. That was technically true. It just was not the kind of rotation Maria was picturing. Here is something worth pausing on for a moment, because this is where the story gets complicated in a way you may not be expecting. You have been listening, and you are probably wondering about Rachel Brennan, where she came from, why she lives alone, why a woman with her obvious skills is working night shifts in a Norfolk hospital when she could be running an ICU somewhere prestigious and well-lit. You are asking the right questions. Keep asking them. The answers are coming. But first, here is what you need to understand about Delta Force, the 1st Special Forces Operational Detachment Delta, the unit that does not officially exist. When you leave, you do not just leave. You carry it everywhere. In the way you scan a room the moment you enter it, in the way you never sit with your back to a door, in the way certain sounds can take you from a hospital break room in Virginia back to a rooftop in Sana'a in a single heartbeat. Rachel Brennan had been Sergeant First Class Rachel Brennan for 8 years. She had operated in Yemen, in Syria, in 2 other countries whose names she was not permitted to say aloud in any context, ever. Not at dinner parties, not in therapy, not in her sleep if she could help it. She had left the unit, not because she wanted to, but because of what happened in the Marib Governorate on a Tuesday in March, 3 years ago. A Tuesday nobody would ever write about in any publication you could find. A Tuesday that cost her something she had not yet figured out how to name. She did not think about it on most nights. On most nights, she thought about IV lines and medication schedules and whether the 3rd floor supply closet had been restocked with the right gauge needles. Tonight was starting to feel different. She finished her coffee. She rinsed the cup. She did it slowly, deliberately, the way she did everything now. The vending machine hummed its approval. The 4th floor was quieter than usual when she got there. 2 Secret Service agents stood at the end of the corridor. Not diplomatic security, not hospital security. Secret Service, she clocked it immediately from the earpieces, the particular stance, the way they tracked her movement without appearing to look at her directly. Professional. Well-trained. She had outmaneuvered considerably better. Sandra Holt met her at the nursing station. Holt was a no-nonsense woman in her late 50s who had been running nursing operations at UMC for 18 years and had the permanently tired eyes of someone who had survived every variety of hospital drama imaginable, including 2 floods, 1 code situation involving a senator, and the great printer shortage of 2022, which nobody talked about, but everyone remembered. Brennan. Good. I need you on direct care for room 412. What is the admission? Holt hesitated a half-second. That was unusual. Sandra Holt did not hesitate. Admiral William Cross. Retired. 4 stars, Navy. He came in 40 minutes ago through the private entrance. Presenting complaint is fatigue and chest discomfort, but his personal physician called ahead and mentioned some irregularities in his recent blood work. Holt said the next part quietly. He has been at a defense contractor dinner all evening. The Secretary of the Navy was also at that dinner. Rachel absorbed this. Who else has access to the room? His security detail. Dr. Marsh is on tonight. Holt said the name the way you say the name of a persistent headache that has decided to move in permanently. He is the attending on call. Of course he is, Rachel said. She pulled on fresh gloves. She picked up the chart. She walked toward room 412. She passed the 2 agents without looking at them. She pushed open the door. Admiral William Cross was 71 years old, and he looked, in this moment, every single one of those years. He was a large man, white-haired. With the square jaw of a recruiting poster, he was sitting up in bed in a hospital gown that seemed to embarrass him at a cellular level. There was a younger man in a dark suit in the corner. "Personal aid," Rachel assessed. "Not security. Too nervous." He had the energy of someone told to stand there and not touch anything, and finding it more stressful than expected. "Admiral," Rachel said, moving to the bedside, "I am Rachel Brennan. I will be your primary nurse tonight." Cross looked at her with the alert, assessing eyes of a man who had spent a career evaluating people quickly and accurately. "Brennan," he said. His voice was still strong, even now. "Yes, sir." Something shifted in his expression. Just slightly. Just for a fraction of a second. Like a man who had just heard a name he was not expecting to hear in this room. Like a man who was trying to decide whether to say something about it. He did not say it. "My chest feels like someone parked a truck on it," Cross said instead. "Tell me that is just the wine." "Let me get your vitals first," Rachel said. She wrapped the blood pressure cuff around his arm. She placed her fingers on his wrist for a pulse. She did it with the practiced calm of someone who had taken vitals. His pulse was irregular. Not alarmingly, not yet, but she felt it. A small stumble in the rhythm. A hesitation, like a sentence with a word missing right in the middle. She checked it again. Still there. She looked at his face. His color was slightly off. Not pale exactly. More like the particular flatness of skin when the blood is not quite going where it should be going with the enthusiasm it should be bringing. She looked at his hands. His fingers had a very faint tremor. She had seen that before, not in cardiac patients. She kept her face completely neutral. "Admiral, did you eat anything tonight that tasted unusual to you? Metallic, perhaps, or bitter?" Cross went very still. The aide in the corner looked up from his phone for the first time. "Why would you ask that?" Cross said. His voice was controlled, deliberate. The voice of a man who had spent decades not showing his cards regardless of the hand he had been dealt. Rachel met his eyes. "Routine question," she said. It was not a routine question. She straightened up. She made a note on the chart. She walked to the door with the measured pace of a nurse doing her job on an entirely ordinary Thursday night in a hospital that handled extraordinary things and never put them in any newsletter. In the hallway, she stopped. She looked at the vital signs she had just written down. Blood pressure, 148/91. Elevated, but not critical. Heart rate, 67 beats per minute, slightly irregular. Respiratory rate, 18, normal. Skin temperature, 97.1, 1 degree below normal. It was that last number that bothered her. Hypothermia did not announce itself loudly. It did not arrive with sirens and a flashing sign. It crept in quietly, slowing everything down, convincing the body that everything was fine, that it had never been better, right up until the moment nothing was fine at all. Rachel had seen that exact pattern once before. In a compound in a country whose name she was not permitted to say. In a man who was dead 6 hours later. She looked down the corridor at the 2 Secret Service agents. She thought about the defense contractor dinner. She thought about the Secretary of the Navy being in the same room. She thought about the specific and very particular set of skills required to administer something that presented exactly like a cardiac event and metabolized completely before anyone thought to look for it. And she thought about the fact that Dr. Vincent Marsh, the man who had washed out of the Army under circumstances the hospital board quietly buried, was the attending on call tonight. Rachel Brennan stood very still in that corridor. 3 years of quiet. 3 years of coffee that tasted like parking garages. 3 years of deadbolts she installed herself, and a name that was not quite hers, and a very specific plan to be nobody. She looked at room 412. She looked at her hands. They were not trembling. They had not trembled since Marib. She took a slow breath. and she walked back toward the nursing station to pull every single piece of the Admiral's intake documentation before anyone else had the chance to make it disappear. Rachel pulled the intake file at 11:47 p.m. She did it casually, the way a nurse does when she is just doing her job. She did not rush. She did not look over her shoulder. She simply sat down at the nursing station, opened the electronic chart, and began reading with the focused patience of someone who had once spent 14 hours completely motionless on a rooftop, waiting for a window of opportunity that lasted exactly 30 seconds. 14 hours for 30 seconds. And she had not complained once, which tells you everything you need to know about her. The intake notes were thin, too thin. A 4-star Admiral arrives through a private entrance, complaining of chest discomfort and fatigue, and the intake notes looked like someone had filled them out in a hurry with one eye on the door and one hand already reaching for their car keys. No detailed history of the evening, no documentation of what he ate or drank, no notation of the other guests at the dinner. The admitting physician had written possible cardiac event, monitoring advised and signed off in a handwriting that suggested he had somewhere else to be and several strong opinions about being interrupted. Rachel read it twice. Then she opened the blood work that had come in from the Admiral's personal physician. She found it on the 3rd page. Plasma cholinesterase levels. Flagged slightly low. The kind of low that a general practitioner might look at and attribute to age or diet, or the Admiral simply having a difficult week with not enough vegetables in it. The kind of low that required a specific and deliberate frame of reference to understand as something else entirely. Rachel understood it as something else entirely. She closed the chart. She sat for exactly 4 seconds. Anyone watching would have seen a nurse pausing between tasks. What was actually happening was considerably more complex and considerably more dangerous. Then she stood up, walked to the medication room, and began pulling the standard cardiac monitoring supplies she would need for the next 2 hours. She moved with complete calm. Anyone watching would have seen a competent nurse preparing for a routine overnight shift. Inside, her mind was running calculations she had not run in 3 years, and they were running fast. The door at the end of the corridor opened. Dr. Vincent Marsh walked in. He was wearing his white coat over civilian clothes, which meant he had been called in specifically tonight. He had not been here earlier. Rachel noted that. She filed it away next to everything else she was filing away, which was becoming a considerable collection. Marsh saw her at the medication cart, and his expression did what it always did when it encountered Rachel Brennan. It settled into something between dismissal and mild irritation, like a man who keeps finding the same inconvenient piece of furniture in rooms he considers his exclusive domain. Brennan. He did not stop walking. Who authorized you on this floor tonight? Nursing Director Holt, Rachel said. I am primary care on 412. Marsh stopped. He turned around slowly. 412, he repeated. Yes. Something moved behind his eyes. It was brief. It was controlled. But Rachel had spent years in rooms full of people who were trying very hard to show nothing at all, and she caught it cleanly. He recovered fast. She gave him that. I will take primary on 412, Marsh said. Reassign yourself to 408 and 410. Holt put me on 412 specifically. And I am the attending on call, which means I outrank Holt's scheduling preferences in a clinical context. He said it pleasantly. The pleasantness was, as always, the most dangerous part of him. Move yourself to 408, Brennan. The patient in 412 requires a physician-led care team tonight. Rachel looked at him. She thought about the plasma cholinesterase levels. She thought about the 14-hour rooftop. She thought about Marib. Of course, she said. She picked up her supply tray and walked toward 408. She did not go to 408. She went to the supply closet at the end of the hall, stepped inside, closed the door behind her, and pulled out her personal cell phone. She had one contact saved under a name that meant absolutely nothing to anyone who might look at her phone. Not a person's name, not even a plausible person's name. Just 2 ordinary words that sat there looking thoroughly unimportant. She sent a single text message. It said, Cross, UMC Norfolk, tonight, Marsh on call. She waited 11 seconds. The reply came back in 4 words. On it. Stay visible. Rachel put the phone away. She picked up her supply tray. She walked back out into the corridor and went to check on the patient in 408, a retired petty officer named Gerald, who had a knee replacement, a deep and abiding love of his own opinions, and a collection of complaints about the mattress that he had organized into what Rachel could only describe as a presentation. The mattress, Gerald informed her with great seriousness, had personal issues with his lower back that predated the surgery and were frankly a matter of institutional negligence. Rachel listened to every word with complete attention, adjusted his pillow, made a note about the mattress in the chart with a perfectly straight face, and walked back out. At 12:22 a.m. she heard the monitor alarm from 412. Not a full code alarm, not the sustained shriek that emptied hallways and sent every available person running. A single sharp alert, the kind that meant a change in rhythm, the kind that was easy to explain away as a sensor issue or a patient shifting in bed. Rachel was already moving before it finished sounding. She pushed open the door to 412. Marsh was at the bedside. He had a syringe in his hand. He was not injecting it. He was holding it in the particular way of a man who had just been interrupted while deciding something he could not afford to be interrupted during. Admiral Cross was awake. Barely. His eyes were open but glassy. His skin had gone from flat to gray. His breathing was shallow. 12 breaths per minute. Maybe 11. His color said 11. Everything is fine, Marsh said. He turned and looked at Rachel with an expression that was nearly convincing. Nearly. The monitor triggered on movement. I was checking his IV line. Rachel looked at the IV line. Then she looked at the syringe in his hand. The syringe was not labeled. In a hospital, syringes are labeled. This is not a suggestion. It is a rule that exists because unlabeled syringes near patients have a history that ends in headlines. Every nurse, every physician, every person who had ever entered a clinical environment knew this without thinking. There was no version of tonight where Marsh had simply forgotten. Marsh was holding an unlabeled syringe at the bedside of a man whose plasma cholinesterase levels were already low. Rachel set her supply tray down on the bedside table. She looked at the Admiral. His eyes found hers. They were glassy and slow, but underneath the glassiness, there was something alert and frightened. The eyes of a man watching something happen to himself that he could not stop, who had just found the one person in the room who might be able to stop it for him. She had seen that look before, not in a hospital. Dr. Marsh, Rachel said, what is in the syringe? That is none of your concern. It is not labeled. I am aware of that. Hospital protocol requires all medications to be labeled before administration. She kept her voice even, not accusatory, not alarmed. Just a nurse stating a fact with the particular calm of someone who was not going to be moved by anything short of a structural event. What is the medication? Marsh turned to face her fully. He was bigger than her by 8 inches and 80 pounds. He had the posture of a man who was used to that being sufficient argument. Brennan, he said quietly, I'm going to ask you one time to leave this room. Rachel looked at the syringe. She looked at Admiral Cross. She looked at the monitor, which was showing a rhythm that had slowed another 4 beats per minute since she walked in. She thought about 3 years of coffee that tasted like parking garages. She thought about how tired she was of being nobody. No, she said. Marsh blinked. It was a small thing, a tiny fracture in the composure. But Rachel saw it the same way she had seen everything else tonight, with a clarity that had nothing to do with the fluorescent lights overhead and everything to do with 8 years of training that did not switch off just because you changed your name and moved to Virginia. Excuse me? Marsh said. I am not leaving this room, Rachel said. And you are not going to administer whatever is in that syringe until it is properly labeled and documented in the chart. Those are the rules. She paused 1 beat. You know the rules, Dr. Marsh. You learned them in the Army. The air in the room changed. It was a small change, the kind most people would not notice. The kind Rachel noticed the way other people notice weather. Marsh looked at her for a long moment. And in that moment, something shifted in his expression. The irritation did not disappear, but something moved underneath it. A recalibration. The look of a man who was seeing someone clearly for the first time and not entirely certain what he was seeing. "You have no idea what you are involved in," Marsh said softly. "I have some idea," Rachel said. From the bed, Admiral Cross made a sound. It was not loud, it was barely a word, but in the stillness of that room, it landed like something dropped from a considerable height. He said one thing. He said, "Brennan." Not as a question, as a recognition. Rachel did not look away from Marsh, but she felt it. The weight of that one word. The specific gravity of her real name spoken by a man who should not have known it. A man lying in a hospital bed with compromised cholinesterase levels and a physician standing over him with an unlabeled syringe who had looked at her face and pulled a name from somewhere that had nothing to do with her UMC employee badge. Marsh heard it too. His eyes moved from Rachel to the Admiral and back again. And for the first time all evening, Dr. Vincent Marsh looked like a man who had made a significant calculation error. The monitor alarm sounded again. This time it did not stop. The monitor screamed. A sustained, single-tone alarm that meant one thing in every hospital in the world, regardless of floor, city, or country. It meant the heart had stopped doing its job. Rachel moved, not the way a floor nurse moves toward an alarm, not the careful, procedural walk of someone following a code blue checklist in the order the checklist specifies. She moved the way she had moved in doorways in Yemen and stairwells in Syria, and a burning vehicle outside a city whose name she was not permitted to say. Fast, low, decisive. Every motion stripped of everything unnecessary, every hesitation removed at the source. She was at the bedside in 2 steps. Marsh was still holding the syringe. Rachel grabbed his wrist. She did not ask. She did not explain. She applied precise lateral pressure to the tendons above his thumb, the kind of grip that was entirely comfortable if you stayed completely still and became extremely uncomfortable extremely quickly if you did not. Marsh went still. The syringe dropped. Rachel caught it with her free hand before it hit the floor and placed it on the far end of the bedside table in a single motion that took less than 1 second. Marsh stared at her. "Step back," Rachel said. He stepped back. She was already at the monitor. Admiral Cross had gone completely gray. His eyes were half open. His jaw was slack. The rhythm on the screen was not ventricular fibrillation. Not yet. It was severe bradycardia, 31 beats per minute and dropping, the heart slowing like an engine running out of fuel, each beat arriving later and quieter than the one before. She knew this pattern. She had seen it in a compound in Marib at 2 in the morning with no equipment, no backup, and a man dying on a concrete floor while she worked with what she had and refused to accept the alternative. She had not frozen then. She did not freeze now. "Call a code," she said over her shoulder to Marsh. Her voice was command voice, not loud. It did not need to be loud. It had the specific quality of a voice that people follow without stopping to ask why. The kind of voice that gets built only one way. Call it now. Marsh did not move. Rachel turned her head and looked at him for exactly 1 second. Something in that look made him reach for the wall panel and hit the code button. She was already working. She tilted Cross's head back. Airway clear. Breathing present, but shallow. She pressed 2 fingers to his carotid. Pulse at 28. The number dropped as she counted. 26, 24. She needed atropine. She needed it in the next 40 seconds or the heart was going to forget how to beat entirely. And hearts that forget do not always remember. She hit the call button on the bed rail. "I need the crash cart at 4:12 now. I need atropine 1 milligram IV push. Now." The voice on the intercom started to ask a clarifying question. "Now," Rachel said, and something in the single word removed the question from the conversation permanently. She looked at the IV line in Cross's right arm. Patent, good flow, no infiltration, She could push directly here the moment the medication arrived. 22 beats per minute. She looked at Cross's hands. The tremor was worse. His fingers were moving in small involuntary contractions, fasciculations, the muscles firing without instruction, the nerves misfiring under a chemical load they were not built to carry. She had seen fasciculations before. She knew exactly what caused them, and it was not a heart attack. She leaned down close to the Admiral's ear. "Sir," she said quietly, "I need you to stay with me. Can you hear me?" His eyes moved toward her voice. "Good," she said. "I know what this is. I am going to fix it. Do not fight it. Let your body go slow. I have you." His lips moved. She leaned closer. "Marib," he whispered. The word hit her somewhere below the ribs. She straightened up. The door burst open, and a young resident named Torres came in fast with the crash cart, eyes wide, already scanning the monitor. Behind him was a night shift nurse named Park, who had a medication tray in her hands, and a look on her face that said she did not yet know what she had walked into, but was already fairly sure it was significant. "What do we have?" Torres said. "Severe bradycardia, 20 beats per minute and dropping. Suspected cholinergic toxidrome. I need atropine 1 milligram IV push immediate, and I need a 2 milligram drawn and ready." Rachel was already moving to the IV port, gloves on, swab in hand. Torres looked at her. Then he looked at Marsh, who was standing against the wall with an expression that belonged on a man who had just watched a building he was certain was empty turn out to contain an entire crowd of informed witnesses. "Dr. Marsh," Torres said carefully, "do you concur with the assessment?" Marsh said nothing. Torres looked back at Rachel. She had the port swabbed and ready. Park handed her the atropine without being asked. Rachel pushed it. She watched the monitor. 15 seconds. 20. The line on the screen stuttered. 22 beats. 25. 28. Torres exhaled. 33 beats per minute. 37. Rachel drew the 2 milligram. She held it ready. She watched the screen with the focused stillness of someone who had learned to wait for exactly the right moment, and understood at a fundamental level that not a moment before and not a moment after was not a suggestion. 41 beats per minute. She pushed the second dose. The monitor climbed. 48. 52. 58. Admiral Cross took a long, shuddering breath. His color changed. The gray retreated, slowly, imperfectly. But it retreated. 61 beats per minute. The room took a collective breath of its own. Torres looked at the monitor, then at Rachel, with the expression of a second-year resident who had just watched something happen that was not in any textbook he had ever opened. "How did you know to go straight to atropine?" he said. "The fasciculations," Rachel said. She was checking Cross's pupils. Equal and reactive, slightly constricted but improving. Classic cholinergic presentation. Excess acetylcholine activity. Atropine is the antagonist. "That is a toxicology call," Torres said slowly. "Not a cardiac call." "Yes," Rachel said. "How did you know it was toxicology and not arrhythmia?" Rachel did not answer him. She was looking at the unlabeled syringe on the table. Torres followed her gaze. He looked at the syringe. He looked at Marsh. Marsh had not said a word in 4 minutes. And that, right there, was the moment Dr. Torres understood that something in this room was very wrong, and that the wrongness had nothing to do with the patient's cardiac rhythm. "Dr. Marsh," Torres said carefully, "what is in that syringe?" The door opened again before Marsh could answer. 2 Secret Service agents stepped in. Behind them was a third man in a dark suit, older, with the specific posture of someone who made decisions that other people carried out, and had been doing so long enough that it had become simply how he held his shoulders. The older man looked at Cross. He looked at the monitor. He looked at Rachel. He looked at Marsh. "Nobody leaves this room," he said quietly. It was not a request. It was not even particularly close to a request. Marsh took 1 step toward the door. One of the agents moved to block it without being told. with the fluid, automatic ease of someone for whom blocking doors was a basic vocabulary word. Rachel set down the second empty atropine syringe. She pulled off her gloves. She turned and looked at the monitor one more time. 67 beats per minute. Stable. She turned to the older man in the dark suit. He needs continuous cardiac monitoring and a full toxicology panel, she said. Specifically, plasma cholinesterase activity and acetylcholinesterase levels. The results from his personal physician flagged low cholinesterase 3 days ago. That is not a coincidence. The older man looked at her for a long moment. "Who are you?" he said. It was a simple question. 3 words. The kind of question that seemed like it should have a simple answer. Rachel had been answering a version of it for 3 years with a name and a nursing license and a studio apartment with a deadbolt she installed herself. She looked at Admiral Cross. His eyes were open now, clear, exhausted, but clear. He was looking at her with an expression she recognized. Not gratitude exactly. Recognition. The specific recognition that passes between people who have been in the same dark rooms and come out carrying the same things. Rachel looked back at the man in the dark suit. She took a slow breath. "I am the person who just kept him alive," she said. "Everything else is a conversation for later." The man in the dark suit studied her face. Then he nodded once. He turned to the agent by the door. "Get me Director Callahan," he said. "Tell him we have a situation in Norfolk and tell him the nurse already solved the medical part." He paused. "Tell him we need to talk about the other part." The room had too many people in it. Rachel registered that immediately. 2 Secret Service agents by the door. Torres frozen near the crash cart with the particular stillness of a man who had understood that he was witnessing something that had nothing to do with the medicine he had trained to practice. Park pressed against the far wall, eyes moving between Marsh and the monitor, and the man in the dark suit with the expression of someone who had signed up for an overnight nursing shift and received something categorically different. And Marsh had not moved from his position against the wall. He had not spoken. He had not tried the door again after the agent blocked it. He was doing what cornered intelligent people do when they know that movement is the wrong choice. He was waiting, calculating, running numbers. Rachel did not trust the waiting. She moved to the bedside and checked Cross's pulse manually. 69. Climbing. His skin was warmer. His breathing had deepened from the shallow, labored pattern of 20 minutes ago into something closer to actual rest. His eyes were closed, but his brow was tight. Not unconscious. Resting. There was a difference she had learned to read in conditions where the difference between the two determined everything that happened in the next 5 minutes. "He needs to stay still," she said to Torres. "No stimulation. If his pressure spikes, we risk overcorrection." Torres nodded. He was writing in the chart with the focused energy of a man who needed something specific to do with his hands, and was grateful to have it. The man in the dark suit had moved to the corner near the window. He was on a phone call conducted in a voice so low it was nearly not a voice at all. Rachel caught fragments without appearing to catch anything. "Norfolk, confirmed." "Yes, tonight." She did not look like she was listening. She heard everything. The older agent stepped to her side. "Ms. Brennan, yes. I am going to need you to walk me through exactly what happened in this room from the moment you entered." Rachel looked at the syringe on the table. "Has anyone touched that?" she said. "No. It needs to go to your lab, not the hospital lab. Whatever is in it is not on the standard tox panel, and the hospital lab will not know what they are looking for." She kept her voice level, informational. The voice of a person sharing a clinical observation, not the voice of a person who recognized a specific class of organophosphate compound because she had spent 8 months learning exactly what it did to the human nervous system in a training program that officially had never occurred. Plasma cholinesterase inhibitor, possibly a carbamate derivative. Fast onset, fast metabolism. If you run a standard panel in 6 hours, it will show almost nothing. The agent looked at her. "How do you know that?" Advanced pharmacology, Rachel said. The agent wrote something down. How advanced, he said. Rachel did not answer. From across the room, Marsh spoke for the first time in 11 minutes. She is a floor nurse, he said. His voice had recovered its smoothness. Not entirely, but enough to try. She has no business making toxicological assessments. Whatever she thinks she saw, she is operating outside her scope. The agent looked at Marsh. Dr. Marsh, he said, we will get to you. I am the attending on call. I have rights in this clinical environment that supersede a nursing director's scheduling decision. I demand to know the authority under which I am being detained. You are not being detained, the agent said pleasantly. You are being asked to stay in the room. That is detention. It is a conversation, the agent said, in a tone that closed the subject like a heavy door with a good lock. Rachel moved to the monitor and adjusted the alarm threshold by 2 points. Small, clinical, routine-looking. What it did was ensure she would hear the earliest possible warning of any secondary event before the number became visible on the screen. She was buying seconds. In her experience, seconds were the currency that mattered most and spent fastest. The man in the dark suit finished his call. He walked to the center of the room. My name is Garrett, he said. No title, no badge. In Rachel's experience, the people who mattered most, I am going to ask Dr. Marsh to step into the corridor with Agent Reeves. This is not optional. Marsh looked at the door. He looked at Rachel. Something passed across his face. Not fear, exactly. The particular expression of a man whose calculations had shifted against him in a room where he had expected to control all the variables. I want counsel present, Marsh said. You will have that opportunity, Garrett said. Agent Reeves. The younger agent appeared at Marsh's elbow with the practiced neutrality of someone who had done this enough times to make it look like standing. Marsh looked at the door. He walked out. The room felt larger. Torres looked at Garrett. Should I stay? You are the physician on this case now, Garrett said. Yes. Torres straightened slightly. He looked at Rachel. She could see him building a picture from the evidence the way a good resident does, following wherever it pointed. The atropine call was right, Torres said quietly. That is a hard call to make that fast. I would have gone to the defibrillator first. Defibrillator would not have helped him, Rachel said. His rhythm was not the problem. His chemistry was the problem. You knew that before the labs. Yes. Torres was quiet for a moment. Where did you train? He said. Colorado, Rachel said. Torres looked at her in a way that communicated clearly that he did not entirely believe Colorado was sufficient explanation for what he had just observed. Garrett moved to her side. Miss Brennan. His voice was different now. Lower. The public voice was gone. This was the voice he used in rooms where the conversation was the real thing. I need to ask you something, and I need an honest answer. All right, Rachel said. When did you first suspect the Admiral was being poisoned? Not a cardiac event. Specifically poisoned. Rachel considered the question. When I read his intake notes, she said. The cholinesterase flag in his blood work from 3 days ago. His personal physician noted it as a minor variation. It is not a minor variation in context. What context? The dinner, the guest list, the specificity of the presentation. She paused. And the attending on call. Garrett studied her. You knew about Marsh. I knew he washed out of the Army under circumstances this hospital does not discuss. I knew his file has redactions that a civilian hospital board would not have access to. I knew he requested to take over primary care on this room the moment he arrived tonight. She kept her voice even. I do not know his specific role, but I know what a man looks like when he is exactly where he is supposed to be. Garrett was quiet for a long moment. You have an interesting way of noticing things, he said. It is a nursing skill, Rachel said. From the bed, Admiral Cross made a sound. Not distress, not alarm. Something more deliberate. Both of them turned. Cross had opened his eyes, clearer than before, still exhausted, still carrying the chemical weight of whatever had been working through his system for hours, but sharp underneath it. The same assessing eyes Rachel had seen when she walked into the room. "Garrett," Cross said. His voice was rough but present. Garrett moved to the bedside. "Sir, do not try to talk yet." "I will talk when I want to talk," Cross said, in the tone of a man for whom this was simply a statement of fact. "The nurse." "She is right here, sir." Cross turned his head. He found Rachel's face. He looked at her with the direct, undecorated attention of a man who had spent a career cutting through surfaces to whatever was underneath every time without fail. "Brennan," he said. "Sir. Rachel Brennan, Fort Bragg, 2019. The room went very quiet. Torres had stopped writing. Rachel held Cross's gaze. "You have the wrong person, Admiral," she said. Cross almost smiled. It was a small thing, the ghost of an expression on a face that was still fighting a compound designed to shut it down entirely. "I never forget a file," Cross said. "Especially not the ones with 6 pages of redactions and a commendation that nobody is allowed to read." He paused for breath. "Yemen. Marib Governorate, March." Rachel said nothing. "You saved 4 men in a burning vehicle," Cross said, "with a tourniquet and a field airway and a trauma kit that had already been used once." Another pause. "The report says you were not supposed to be there." "The report is classified," Rachel said. "Yes," Cross said. "It is." Garrett was looking at her with an expression entirely different from the one he had walked in with. The monitor beeped. 72 beats per minute. Clean rhythm, the numbers moving in the right direction. Rachel straightened up. She adjusted the blanket across Cross's chest. She checked his IV line. She noted the time. She did all of it with the same measured calm she had brought to every motion tonight. She was a nurse doing her job. She was also a woman whose name had just been spoken aloud by a 4-star admiral in a room with a federal agent, and 3 years of carefully constructed invisibility had just developed a crack that was not going to seal itself overnight. "You need to rest, sir," she said to Cross. "Probably," Cross said. His eyes were closing. The effort of speaking had cost him. "Brennan." "Sir." "Good to have you back," he said. He was asleep before she could answer. Rachel stood at the bedside for a moment. She looked at the monitor. She looked at Garrett, who was watching her with the careful attention of a man who had just found something he had not known he was searching for. She looked at the door. Beyond it, in a corridor that smelled of antiseptic and institutional carpet, Marsh was standing with an agent at his elbow and the particular stillness of a man who had run out of moves. Beyond that, the hospital went on being a hospital. Monitors beeping, gurneys rolling. People trying to stay alive in the ordinary. Uncomplicated ways that people try to stay alive every night in every city in the country without any of this accompanying drama. Rachel picked up the chart. She made her notes. She did not write what Cross had said. She carried that herself. She felt it settling around her like a change in air pressure before a storm that has already decided to arrive. 3 years of nobody. Ending tonight. Garrett made 2 phone calls in the corridor. Rachel heard none of them. She did not need to. She had read the room well enough to understand that the calls were not about Admiral Cross anymore. Cross was stable. The medicine had done its work. The calls were about the other thing. The thing that had walked into room 412 in a white coat with an unlabeled syringe and had not yet been fully explained to anyone's satisfaction. She was checking Cross's pressure for the 3rd time when Garrett came back in. He closed the door behind him with the careful quiet of someone who had decided the next conversation was not for the corridor. "Marsh is not talking," Garrett said. "I know," Rachel said. "You know because he is not stupid." She noted the pressure reading on the chart. Improved, consistent. He knows what he did, and he knows what he did not do. The syringe is the problem. Everything else is circumstantial. He will wait to see what the syringe shows before he says anything at all. Garrett looked at her. That is a fairly precise assessment of a suspect's legal strategy for a floor nurse, he said. Rachel set down the cuff. She turned and looked at Garrett with the direct, unhurried attention she had been carefully withholding from him all evening. "What do you need?" she said. Garrett studied her for a moment. Then he made a decision. She could see it happen. The small shift in posture. The specific stillness that precedes commitment. She had seen it in briefing rooms in places she was not permitted to name, and she recognized it clearly in the flat fluorescent light of a Norfolk hospital room. "The dinner," Garrett said. 14 people, including the Admiral. We have 12 accounted for and cleared. The other 2 are a defense contractor named Alan Reese and a logistics coordinator named Dana Vo. Both cleared preliminary. But the poison, if it is what you think it is, had to come through the food or the drink, and it had to be administered by someone with specific knowledge of dosing. This is not something you order with next-day shipping. "No," Rachel said. "It is not. The synthesis requires access to precursor compounds that are monitored at the federal level. Military labs, private contractors with DoD clearance, pharmaceutical research facilities, or someone who brought it back from somewhere it is not monitored," Rachel said. Garrett went still. "Meaning overseas sourcing. Meaning a specific class of organophosphate that was documented in use by non-state actors in the Arabian Peninsula. 2018 to 2021. We tracked 3 separate incidents in Marib Governorate alone." She held his gaze. "It does not show on standard panels because it was never catalogued by domestic forensic labs. It was catalogued by field intelligence units operating in theater. The room was very quiet. Torres had long since understood that his role tonight was to monitor the patient and hear nothing else. He was doing that with admirable and very deliberate focus. "You have seen this compound before," Garrett said. "Yes. In theater." "Yes. Marib Governorate." Rachel said nothing. Garrett breathed out slowly. "Brennan," he said, "I need to know how much of what you know is clinical and how much is something else." "All of it is clinical," Rachel said. "Where I learned it is the something else." Garrett looked at the Admiral. He looked at the syringe in its evidence bag. He looked at the door. Then he looked at Rachel with the expression of a man who had stopped pretending he did not know what he was looking at. "I need your help," he said. "You have my help," Rachel said. "You have had it since 1147. I need more than nursing care. Tell me what you need." Garrett moved to the small table near the window. He pulled out a tablet and opened a file. He turned it to face her. It was a photograph. A man in his early 50s at what appeared to be a formal dinner. Dark suit, unremarkable face. The kind of face, Alan Reese, Garrett said, defense contractor. His company holds 3 active DoD contracts totaling $900 million. One of those contracts is under review for fraud. Admiral Cross was the reviewing officer. Rachel looked at the photograph. She looked at it for a long time. "I have seen this man before," she said. Garrett went very still. "Where?" Rachel looked up from the photograph. She looked at Garrett. She looked at Torres, who was not looking at her. She looked at the sleeping Admiral. She had spent 3 years being nobody. A quiet woman with a deadbolt, she installed herself and coffee that tasted like parking garages, and a name that was not quite hers. She had made that choice with clear eyes and a specific reason. But she had also spent 8 years being someone who did not look away when a man in a photograph was connected to a compound from the Arabian Peninsula that had killed people she knew by name. "A staging facility," Rachel said. "Outside Maribat, 2020. He was not there as a contractor. He was there as a courier. Moving equipment that was not on any manifest we could account for. We flagged him. The report went up the chain." She paused, and then it went quiet. Garrett's jaw tightened. "It went quiet because Reese has relationships in this building that I am currently in the process of mapping," he said. which is why Cross was the last person who should have been in the same room with him tonight. Cross knew, Rachel said. Garrett looked at her sharply. When I leaned down to him, Rachel said, before I pushed the atropine, he said Marib. He was not confused. He was telling me he knew exactly what it was. He walked into that dinner knowing the risk. He was building a case, Garrett said quietly. He was going to let Reese make the move and document it. That is a very dangerous way to build a case. Cross does not do things the easy way. Rachel looked at the Admiral, breathing steadily. Color almost normal, monitors clean and consistent. He had walked into a room with a man he knew wanted him dead and had done it wearing a dinner jacket and apparently eating the food and making pleasant conversation and waiting. She found, against her better judgment, that she respected him enormously for it. Enormously, and with a specific kind of recognition that she did not entirely want to examine too closely. The door opened. Not a knock, not a slow push. It opened the way doors open when the person on the other side has just received information that fundamentally changed the timeline of everything they were doing. It was Agent Reeves. His face was controlled. His eyes were not. "Garrett," he said. "Reese is in the building. The room changed temperature." "What?" Garrett said. "He arrived at the main entrance 8 minutes ago. Said he was here to check on the Admiral. Security logged him as an approved visitor. He is on the elevator. And here is where you need to really pay attention. Because you might think the hard part is over. You would be wrong." Rachel was already moving. She did not wait for instruction. She moved to the supply cabinet, opened it, and pulled out 2 things. A cardiac medication tray she had no intention of using for cardiac purposes, and a portable pulse oximeter she held in her right hand with the particular grip of someone who understood that a hard plastic object was better than nothing if the situation deteriorated before backup arrived. Torres looked at her. "What are you doing?" he said. "Stay with the Admiral," Rachel said. "Do not let anyone administer anything to him. Nothing. Not fluids. Not medication. Nothing that is not already running. Can you do that?" Torres looked at the monitor. He looked at Rachel. He was a second-year resident who had ended up inside something that had no name he could currently identify. "Yes," he said. "Good," Rachel said. She looked at Garrett. He was on his radio, giving instructions in the low, flat voice that meant the instructions were serious, and the margin for error was effectively 0. He lowered the radio. He looked at Rachel. "He is going to try to finish it," Rachel said. "Not Marsh. Marsh is already done. Reese is going to come in here as a concerned dinner guest, and he is going to try to finish what the syringe started. He is going to use something that looks like nothing. A handshake, a pen, a business card with a contact transfer compound on it." "A contact transfer," Garrett said. "It is the same family of compound. You do not need an IV. You need skin contact in 30 seconds. She kept her voice even. "I have seen it used." Garrett looked at her for a long, hard second. "Tell me what you want to do," he said. Rachel looked at the door. She thought about 3 years of nobody. She thought about what it had cost her. She thought about a concrete floor in Marib and 4 men who had come home because she had refused to be nobody at the moment it mattered. "I want to be in the hallway when he comes off that elevator," she said. Garrett held her gaze. He nodded once. Rachel walked to the door. She opened it. The corridor was bright and empty and smelled of antiseptic. At the far end, the elevator light was on. Going up. Alan Reese stepped out. He was exactly what the photograph had promised. Unremarkable. Medium height, medium build, a face assembled from features that did not stick in memory. Dark suit, a small gift bag in his left hand. The expression of a man who was deeply and genuinely concerned about an old friend. Rachel was standing 12 feet from the elevator. She was holding a patient chart. She looked like a nurse doing her rounds on an ordinary overnight shift. Reese's eyes swept the corridor the way eyes do when they have been specifically trained to sweep corridors. He clocked the nursing station. He clocked the room numbers. He clocked Rachel. He smiled at her. It was a warm smile. Practiced. The kind of smile that had opened doors in considerably more secure buildings than this one. "Excuse me," Reese said. "I am here to see Admiral Cross. Room 412. I am a family friend." "Of course," Rachel said. "Can I see your visitor pass?" Reese reached into his breast pocket. Rachel watched his hands. She watched specifically the way his left hand adjusted its grip on the gift bag. A small shift. A micro-adjustment that had nothing to do with the bag's weight and everything to do with what was inside it. "Sir," she said, stepping forward, "I need to ask you to open the bag before you enter the room. Hospital protocol for VIP admissions. Security measure." Reese looked at her. The warm smile stayed exactly where it was. "Of course," he said. He held out the bag. Rachel did not take it. "On the cart, please," she said, gesturing to the supply cart beside her. Reese set the bag on the cart. He began to open it, and then Garrett came around the corner. He was not alone. 2 agents flanked him. Behind them was the older man Rachel had not seen before, with the bearing of someone whose authority required no introduction in any room he entered. Reese saw them. The warm smile disappeared. Not slowly, all at once, like a circuit breaker tripping. What replaced it was not panic. It was the cold, stripped expression of a man who had run the final calculation and found the number he had been hoping would not appear. He looked at the bag on the cart. He looked at Rachel. He looked at Garrett. "Mr. Reese," Garrett said, "step away from the cart." Reese did not step away from the cart. He reached into the bag. Rachel moved. She grabbed his wrist with both hands, the same grip she had used on Marsh, hard pressure against the flexor tendons, and she twisted outward and down with her full body weight behind the motion. Reese was bigger than she expected. He pulled against the grip. She planted her left foot and redirected his momentum forward instead of fighting it, using his own pull to take his balance, and then the agents were there, and it was over in 4 seconds. Reese went face down on the corridor floor. The bag tipped off the cart. A small glass vial rolled out and came to rest against the baseboard. Nobody touched it. Garrett crouched down and looked at it without picking it up. He looked at Rachel. She was breathing hard. Her hands were steady. "Good call on the cart," Garrett said. "He was going to transfer it during the handshake," Rachel said. The bag was cover. The compound was on his right palm. Polymer-based adhesive carrier. Slow absorption. Would have looked like a delayed cardiac event in the morning. The older man stepped forward. He looked at the vial. He looked at Rachel for a long time. Then he looked at the agents. "Get him up," he said. They got Reese up. He did not speak. He did not look at Rachel again. He looked at the floor, the way men look at floors when they understand that everything they built is gone, and the only question remaining is how much of it can be proven. The body is just a system. Systems can be regulated. This was something she had been told once by a man from a small town in Ohio who had understood the body and people and the spaces between what you feel and what you do better than almost anyone she had ever known. She walked back to room 412. Torres was at the bedside. The monitor was clean. Cross was still sleeping, his breathing deep and regular, his color almost fully restored. He looked in this moment like a man who was simply old and tired and resting after a long day. Rachel stood at the foot of the bed. She watched the monitor. 74 beats per minute. She felt something release in her chest. A tension she had been carrying since 11:47 that had nothing to do with the medicine and everything to do with the specific weight of being responsible for a life when you understand exactly how fragile the line is and how little it takes to cross it. She had held the line. Torres looked at her. "Is it over?" he said. "The immediate part," Rachel said. Torres nodded. He looked at the chart in his hands. "I am going to have to document this," he said carefully. "All of it. The atropine call, the toxicology assessment, the corridor." He paused. I do not know how to document what I watched tonight in a way that fits the standard forms. Document the medicine, Rachel said. The rest is not yours to document. Torres looked at her with the eyes of a young physician who had just learned something about the world that his residency had not included in any syllabus. Who are you? He said. Not accusatory, not demanding. Just a man asking a real question and meaning it. Rachel looked at the Admiral. Tonight I am his nurse, she said. Torres accepted that. He wrote it down. The door opened softly. Garrett came in. He looked at the monitor. He looked at Cross. He looked at Rachel with an expression she could not entirely read, which was unusual, because she could read most expressions without working hard at it. Reese is in custody, he said. The vial is going to the lab tonight. Marsh is cooperating. He was not the architect. He was recruited 6 months ago. Reese had leverage on him from the Bagram incident. Blackmail, Rachel said. The oldest kind. His choice tonight was the worst one available to him, but it was a choice made by a frightened man, not a believer. Garrett was quiet for a moment. That will not save him from what comes next, but it is worth knowing. Rachel said nothing. The Admiral will wake up in a few hours, Garrett continued. When he does, there are people who will want to speak with him. And there are people who will want to speak with you. Rachel looked at him. The man behind you, she said. The older one. Who is he? Garrett almost smiled. Someone who has been looking for you for about 18 months, he said. Not in the way that ends badly. In the other way. Rachel was quiet. She looked at the monitor. She looked at her hands. She thought about the studio apartment with the deadbolt she installed herself. The coffee that tasted like parking garages. The name that was not quite hers. 3 years of quiet that had felt, on the best days, like peace, and on the other days, like a room that had all its windows painted shut. She thought about Marib. She thought about the 4 men who had come home. She thought about the one who had not. His name was Daniel Yates, Staff Sergeant, 29 years old, from a small town in Ohio whose name she could say in her sleep even now, even here, even after everything. He had been her team medic. He had been the one who taught her that it was never about the equipment. It was about the refusal to stop. He had been in the vehicle too. He had been the one who did not make it out. She had carried that into Virginia, into every overnight shift and every IV line, and every moment she stood at a bedside and kept someone alive with the knowledge he had given her. All of it came from him. She had never said his name out loud in 3 years. She said it now, only to herself. Only in the quiet of her own chest, where it lived next to everything else she carried and had learned to carry without showing. Daniel, I kept one alive tonight. The monitor beeped. Steady, clean, 74, 75, 74. Then it changed. Not dramatically, not with the alarm that had screamed earlier. A single, quiet alert. The kind that meant a small shift in rhythm. The kind that was easy to think was a sensor adjustment or a patient movement. Rachel looked at the screen. The number was fine. The rhythm was fine. She looked at Cross. He was still sleeping. His face was relaxed, peaceful. His chest rose. It fell. It rose again. It did not fall. Rachel moved. She was at the bedside in one step. She pressed her fingers to his throat. She felt for the carotid. She counted. Nothing. Nothing. 1 beat. Then nothing again. Torres was there. The crash cart was there. The paddles were there. Everything that was supposed to be there was there, and Rachel used all of it. She used it the way she had used everything tonight, with complete precision and no wasted motion, and the absolute refusal to accept an outcome before every single option had been exhausted. Garrett came to the doorway. He did not speak. He watched. 22 minutes. That is how long they worked. 22 minutes of everything medicine could offer in a room in Norfolk in the middle of the night, with a team that would not stop until the moment when stopping was the only honest thing remaining. Torres called it at 1:47 a.m. He said the time quietly. He stepped back. Rachel stood at the bedside. She did not move for a long time. She looked at the man in the bed, the white-haired Admiral who had walked into a room with a man who wanted him dead and had done it anyway, because the evidence needed to be built and the case needed to be made. And some people understand duty as something that does not pause because the personal odds are unfavorable. She thought about what he had said. Good to have you back. She had not answered him. She had not answered him. And she would carry that for a very long time. She reached out, and she straightened the blanket across his chest. She did it carefully, with both hands, the way you do for someone who deserves to be treated with care even now, especially now. The blanket had been there since she adjusted it hours ago, and it had not moved. But she straightened it anyway because there was nothing left to do, and she needed to do something with her hands. She stepped back. Garrett was still in the doorway. His face had aged 10 years in the last 22 minutes. Rachel looked at him. The compound did more damage than the atropine could reverse, she said. Her voice was steady. Nurses learn to make their voices steady because the people around them need that steadiness the way they need air. It is not that the feelings are not there. The cardiac tissue was already compromised before tonight. The secondary event was the compound finishing what the earlier dose began. You did everything, Garrett said. Yes, Rachel said. It was not enough. It was never enough, and she knew that, and had always known that, and the knowing never made it easier and was not designed to. She walked to the window. Norfolk at 2 a.m. was dark and quiet and entirely indifferent to what had just happened in this room. The lights of Naval Station Norfolk were visible in the distance, the same lights that had been visible when she arrived 3 years ago with a duffel bag and a new name and a plan to be nobody. She put her hand flat against the cold glass. She stood there for a moment. She turned around. She picked up the chart. She made her final notes. She documented the time, the interventions, the outcome, the clinical language that translated 22 minutes into something that could be filed and read by people who had not been there. She did not write what he had said to her. She carried that herself. She walked out of room 412 and back into the corridor that smelled of antiseptic and institutional carpet. She walked past the nursing station where Maria Chen would arrive in 2 hours for the morning shift with coffee and an extensive collection of questions that Rachel was not going to be able to answer in any way that would fully satisfy her. She walked to the break room. She poured coffee that had been sitting since midnight. It tasted like a parking garage. She drank it standing at the window, looking at the dark city, breathing in and out with the measured, steady rhythm of a woman who understood that you do not get to fall apart until the shift is over. The shift was over. She fell apart, quietly, just for a moment, just enough. Then she straightened up. She rinsed the cup. She placed it upside down on the rack beside the sink. She went back to work, because that is what you do when you are a healer. You carry it. You grieve in the spaces between, and then you go back. You always go back. Some nights there is no victory. Some nights you do everything right, and the outcome still breaks your heart. And the hardest truth about people who save lives for a living is that they know this going in. They have always known it, and they show up anyway. Every single shift. That is not strength by accident. That is a choice made deliberately in the quiet, when nobody is watching. If this story reached something in you tonight, I want to know. Leave a comment and tell me which moment stayed with you. Was it the corridor, the 22 minutes, or the very last cup of coffee? I read every single comment, and I mean that. If you want more stories about people who carry more than they show, subscribe and hit the notification bell. There are more people like Rachel out there. More stories that deserve to be told. Do not miss them.